In this video, I will talk about the most common signs and symptoms of the mother's breast when nursing, what it means, and the things you can do to help relieve the symptoms at home before it becomes worse. Hello parents, this is Nurse Cherry from Mother Baby Central. This is a place you need for great information on how to take care of moms during pregnancy and postpartum, and babies during newborn stage and first year of life. As we all know, breast milk is the gold standard for baby nutrition. Nothing will come close to all the benefits it gives. That being said, we then need to protect the vehicle, mom's breast, at all costs. And for us to do that, we need to educate ourselves about the most common signs and symptoms and how to manage them to avoid interruption of breastfeeding. Did you know that interruption of breastfeeding is one of the most common causes of the decline of milk supply and one of the most common cause of the conclusion of breastfeeding before the recommended time? Symptom number 1, nipple pain. For the most part, nipple pain is one of the most common complaints with breastfeeding. It usually occurs on the first week after delivery and resolves within a couple of weeks. First-time breastfeeding moms are usually the ones mostly affected, just because the nipples have not toughened up yet from the baby's frequent nursing. There are multiple reasons for nipple pain, and proper identification of the source is as important as finding how to relieve the discomfort. Improper latch is one of the obvious reasons. Different breastfeeding positions can help with this, but further investigation as to why there is improper latch should be identified, like is there a presence of a tongue tie? Aside from that, it can also be caused by a fungal or bacterial infection. If it is not caused by any infection, how do you treat nipple pain? First, you can use an oil-based lubricating cream and application of a hydrogel pads on top of the nipples. The hydrogel pads provide instant cooling relief and soothes the soreness. Quick tip: be careful in using different kinds of nipple cream with multiple ingredients because it can cause an allergic reaction. If the pain is accompanied by trauma, the doctor might prescribe a topical steroid, but it might affect the healing time. So keep that in mind. You can also use a cold compress, but remember, this can cause constriction of the blood vessels, which can affect letdown reflex. One of the best things to do is to rest the nipples. And while doing that, you can do either hand expression or pumping. But the latter is preferable because pumping can cause plug ducts, overproduction of milk, and mastitis. Definitely consult a lactation specialist for a more thorough assessment and assistance with proper latch and effective milk transfer. Symptom number 2, engorgement. Next to nipple pain, engorgement is one of the most common symptoms of the breast during the first few weeks after birth. There are few reasons why engorgement happens. First, milk is accumulated in the breast and, if not removed, causes congestion, which eventually results to edema secondary to the swelling and obstruction of the lymphatic system. How do you prevent engorgement? First, empty the breast frequently and effectively. Second, gently massage the breast as you nurse. And third, make sure you wear an adequate supportive bra. Don't let the breast hang out. If you think pumping the milk from your breast using an electric breast pump is effective in relieving engorgement, think again. Hand expression is better in relieving the pressure, making the breast softer for the baby to latch and breastfeed as per usual. You don't want to overstimulate your breast because this causes overproduction of breast milk, resulting in more engorgement. Yes, it is a vicious cycle, so you need to find the sweet spot between breast emptying and avoiding too much stimulation. Before getting the baby on, one pro tip: it is a good practice to apply a warm compress to promote vasodilation. By the way, if you stick until the end of this video, I will share a bonus where I will provide an answer if breast surgery, whether a reduction or augmentation, will affect breastfeeding in general. So stick with me. Next on our list, symptom number 3 is plugged duct. Plugged duct is a painful and localized obstruction of milk flow which lasts less than 24 hours. It feels like a small lump or tender area in a specific area of the breast. It usually happens when the baby sleeps longer than the usual and also caused by pumping and the use of a nipple shield. What can you do to relieve a plug, doc, you may ask? Putting the baby on the breast, gentle massaging of the breast while nursing, and application of a moist, warm compress to the affected area. Don't do too much pumping or massaging because it can make it worse. If it is not relieved though, the plug duct might end up as mastitis. If it lasts for more than a couple of days, I think it is wise to consult your doctor. Number 4, mastitis. Mastitis affects less than half of breastfeeding moms. It starts with pain, then you will notice some redness, some swelling, and warmth on the affected area. Moms, listen to this. You will know you have mastitis if you feel like you have the flu. You will have fever, chills, body or muscle ache, fatigue, and headache. What do? Continue breastfeeding on the affected side. Take an anti-inflammatory medicine like ibuprofen. Take this medicine with food and a full glass of water. Apply cold or warm compress and massage the breast. Not all cases of mastitis require antibiotics. If you catch it early, you might not need one. But if you don't, definitely consult your doctor for further evaluation. If mastitis doesn't get prompt treatment, this leads to our next sign, which is abscess. An abscess is a fluid-filled, movable mass in the breast accompanied by redness, warmth, pain, and swelling. There is a specific medical management for every patient that comes with this condition. It really depends on the size of the abscess that you have. So I will not dig deeper into this. Your doctor will explain to you the best treatment accordingly. What you can do though is to continue to breastfeed on that side of the breast and avoid pumping. Take the full course of antibiotics if prescribed and make sure to take that medicine with food and a full glass of water. And now for the bonus tip. Can a woman who had breast reduction or augmentation can still breastfeed? With breast reduction, the data is weak to provide a definitive answer about lactation and previous breast surgery. Therefore, a strong support is needed, especially during pregnancy and postpartum period, to discuss and make a plan to ensure proper milk transfer and adequate weight gain for the baby. Partner with your provider and lactation consultant to support you along your breastfeeding journey. What about breast augmentation? The data is also unclear. Proper counseling with a doctor who will perform the surgery should be in place, especially if the woman has plans to have a baby and breastfeed in the future. Several factors can make an impact on lactation, like the size, location, and type of the implant, and the location of the incision. Therefore, a clear messaging and thorough discussion has to take place before the surgery. The same advice I will give during pregnancy and postpartum. A close and supportive relationship with your provider and supervision from your lactation consultant is highly recommended. And there you go, moms, the most common signs and symptoms of the breast you need to know and how to manage them at home. If you find value in our video for the day, click on the like button and share it with your friends. Let's empower every mom to attain the best breast care while nursing. Be well, everyone. Make this day count. And happy watching!